MP Julie Dzerowicz, welcome back to Correio da Manhã, Canadá. It's always a pleasure to have you back on our channel.
Olá, é prazer estar aqui com vocês.
The pandemic has, as you know, has been hitting hard on Canadians lately, and the new imposed measures have taken a toll on people's bank accounts and business. So my first question for you is, how worried should Canadians be at this point forward with the Omicron variant and possibly new ones? Is there any chance of any lockdown in place in the near future?
Well, first, thank you for the question and thank you for the opportunity to be here. Look, you know, already Canadians are stressed, so I want to add more stress to them. I actually think that there are already parts of Canada that are already experiencing a partial lockdown. I think that there's nobody that wants to close down the economy anymore. Simply, we can't afford it. You know, both at a local level, at a national level. So I would say if Canadians are following the local public health measures, they will be fine. So that is why I say to people, it is hard, particularly those who have kids who have to stay at home. But if you follow the local public health measures, you will be fine. And we will get through this fifth wave that we have in Canada, and we'll get through it. And hopefully it's going to be sooner than later.
So in light of what you said in regards to people's being scared and having to stay at home, sometimes with the kids, we know that recently the government has announced the extension of the Canadian worker lockdown benefit. So my question is, who is eligible for this subsidy and how can they apply? On what conditions?
Yes, well, thank you. So there's actually two key subsidies that are available. So one is for businesses, and it's called the local lockdown program. And the second one is, as you mentioned, it's called the Canada Worker Lockdown Benefit. So if you are an employee, so I'll talk to what your direct question was around the Canada Worker Lockdown Benefit. If you're an employee and your hours have been reduced by 50% or more, then you can apply to receive $300 a week for the Canada Worker Lockdown Benefit, and you apply through the CRA, through the Canada Revenue Agency. So those that had previously applied for the Canada Recovery Benefit or the Canada Emergency Recovery Benefit, which is the two versions before the worker lockdown benefit, it's the exact same process. So I think most people who've applied for these types of emergency supports programs would know how to apply, but it is through our CRA system. And it's available right now and it's in place right now. People can apply right away.
And until when are they able to receive this subsidy?
I think right now, my notes say that we have it until February 12th, but if the partial lockdown continues, it will continue for as long as that lockdown is in place in that area. So in Toronto, which is where I live, right now there is a 50% capacity for a number of businesses. So for your retail stores, it's 50% capacity. For places like indoor dining, you cannot have indoor dining. All you can do is actually take out. So all of those people would be eligible right away. And it's even, you know, if you were impacted even before today, so as of anytime after December 19th, it's retroactive. And right now we have it until February 12th. But again, if the lockdown continues, so say in Toronto, they say, oh, February 12th, it's not over yet, and there needs to be an extension, then we'll probably be also extending that deadline.
A lot of people have been vaccinated in the country so far, and federal and provincial governments have obviously incentivized those who didn't to take the shot. But what happens to those who still think it's not worth to take the vaccine? Are there any restrictions for the anti-vax groups?
Yeah, it's an excellent question. We currently don't have any penalties against people who are not vaccinated. it's difficult for them to go into whether it's stores or whether it is previously it was into dining rooms or in, when we had venues open for like shows and stuff like that. So people had to be fully vaccinated. And actually to travel in Canada, whether it is in Canada, like even like when I go to Ottawa, I have to always show my vaccination record. So it limits what you can do in Canada, but so far we don't have penalties. I will tell you though, Teresa, I think we're all starting to look at whether or not we need to have penalties. I had a parent write to me yesterday, and she said, my son and daughter have to stay at home because there's a number of people that don't want to be vaccinated. So because we don't want our healthcare system to be overwhelmed, 2 million Ontarians, so 2 million children in Ontario have to stay home from school and actually learn online. And for many of those kids, it's impacting their mental health. And so right now, there is a key question that I think all governments are starting to look at right now, whether or not we are going to be penalizing or forcing those that are not vaccinated to be vaccinated. So for example, you might have heard the story, Teresa, in Italy, they've just put out to say everyone over 50 has to be vaccinated. And what's happening is when you have a few people determining the fate of our economy, the fate of our children and their future and their education, and our ability to be able to work, unfortunately, now we're starting to think it's too unfair and the impact on our lives and our economy is too great.
Portuguese communities, a community you have been very supportive to for the past years. Are there any news or important information we should pass on to them as you usually do?
In Canada right now, there's enough booster shots for every single eligible Canadian. There's also enough vaccines for all kids above the age of 5 who to be vaccinated. And in Toronto, which is where I live, we've only made it available for children between the ages of 5 and 11 for the last 3-4 weeks. And already over 45% of them are vaccinated, which is excellent. And maybe the one other message I want to tell the community, we're all wearing cloth masks right now, but Omicron is much easier to get. So you have to put on the surgical mask. Okay, you can get it in the local pharmacy. It's surgical mask. It looks like something you would wear in a hospital. And it is those surgical masks that we're telling people to make sure they have. Some people are wearing both. They put on the surgical mask and then they put the cloth on top, which is fine as well. Obviously, the standard is N95. But in many places, Teresa, those are very expensive. And so many people are like, it's too expensive for us to buy. But so we're telling people, if you're not able to afford or access N95 masks, then we're encouraging you to get the surgical mask. You can buy it at the No Frills, or you can get it at the local Shoppers Drug Mart, at local drugstore. And those are the ones that better protect Omicron from penetrating and you sort of gaining access to it.